Karen Jepson, who's kindly volunteered to be the recipient of a polarity session. And I'm going to show you how to do a complete session. As she gets on the table, she has no shoes on, which is important. It's very difficult to do a polarity session while somebody's wearing shoes. You'll find out why in a few minutes. First thing you do when you're doing a polarity session is rub your hands together and encourage the person on the table to start breathing. So would you start breathing, please? I hate it when they turn blue. It's awful. Put my hands down so the thumbs are just above the ears, gently touching, fingers down, sides of the neck. I make myself comfortable, so my position is comfortable. I may want to breathe too. Now this is called the cradle position, and it's very comforting to the person receiving the session. It often relieves nervousness, headaches, anxiety, and light pressure on the forehead. I press down just hard enough to get the tummy going back and forth. Second move is called lean and pull. What I do is I place the heel of the foot on my left palm. I take the ball of my hand and place it against the ball of the foot, and I lean forward with a fair amount of pressure. You want to put this foot back? Yeah. I lean forward with a fair amount of pressure, and then I pull down. I take hold of the top of the foot. Now take a look at the knee right here. I bring the knee so it just comes up maybe a half an inch. But I don't want to put any more pressure on that because I don't want to hurt her knee. This opens up that whole area. Place a thumb down below where it connects to the toe, and you're going to pull straight back and shake it a little bit. So we come from the feet back up to the head to do a right and left side occipital press. After this, I'm going to come back down to the hand. And I'm going to work on the right hand here. This is the principle where, because you're working the center line of the body with the right hand, you'll have the left hand on both sides. What I'm going to do is I'm going to press into the collarbone and rock the body. We've opened up the major areas of blockage of the body: the head, the hands, the feet. And now it's time to do some of the finishing moves, and these are just polarizing moves at this point. This one's a hand and foot move. It's one of the ones that I taught the children to do. I hold your hand in mine, and I hold the foot. A hip and shoulder hold. It's a rock move as well. What I do is I take the right hand and put it over to the left hip here, and the left hand is on the right shoulder. Now this often puts people right to sleep, or they may see colors. But my thumbs go down by the crown of the head, and my fingers spread out evenly over the sides. Left hand at the back of the neck, and my right hand near the base of the spine. I'm just going to gently rock forward with my right hand, creating this rocking motion. It's a very gentle rocking motion. Call it spinal charging. So have her get up off the table, and you may see a little bit of difference in her color and complexion right now. Usually people look a lot more relaxed and wonderful. Thank you so much, Karen.
Thank you. That was
really
excellent.
Nice. Yeah.
What we're going to be doing is showing how you can apply polarity therapy to a chiropractic practice. The most common move you can do is the cradle, and that can be used for whiplash. Someone just had a car accident. They're have a lot of stress and tension, and they have a lot of, and it's all located in the suboccipital muscles here. So what you do is take your fingers and put them under the occiput right here. Now, we can also use applied kinesiology and apply the polarity techniques to this. And the way we do that is by muscle testing. You find a strong arm and just push straight down and resist, hold, and the muscle is strong. Then bend your knees, please. Up here. Okay, and then we can test the toes here. Each toe represents a different polarity element. The smallest toe represents the earth element. The next toe over represents the water element. The middle toe is the fire. The fourth toe is the air, and the fifth or the largest toe is the ether element. Now, the ether element represents the different chakras or emotional centers of the body. The air toe represents shoulders, kidneys, and ankles. The fire toe represents eyes, solar plexus, and thighs. The water toe represents chest, pelvis, and feet. And the earth toe represents the neck, bowels, and knees. Now, you can muscle test all 4 toes at once. Now hold, and it goes weak. So now we know that there's an imbalance on the left side of the body. So now we can test each individual toe. Hold, 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 and hold. So we just find the water toe going weak. And now we can test each individual aspect of the water toe. So first chest, pelvis, and feet. So the pelvis part goes weak. So that means we have a water element imbalance. And that would be somewhere in the psoas muscle along this line here. Then we can do the toe pull here. And this is a very powerful technique to pull on the toes because it releases a tremendous amount of energy. Then we can move up to the chest. There's a sore spot on the chest. And we're using a positive finger on the lower and a negative finger on the upper. Each toe represents a different area of the body. So for the earth toe, neck would be around the third cervical, bowels would be the ileocecal valve, and knees would be the lateral meniscus of the knee. Okay, so these are the Bach remedies in a test kit. And what we do is test the arm, it's strong, test the toe, it'll go weak, then test each individual remedy, each section of remedies, and then we'd find the one remedy, hold, hold, hold. This one remedy here, Star Bethlehem, is the one that would fix it. Place that on the body, then retest the toe, hold, and that's strong. So this is the remedy that would balance the polarity element. Now, in addition to the 5 elements, we have the 5 and 6-pointed star, which we can test by testing here. Hold, that's a 5-pointed star imbalance. We can also test the energy flows. There's a centripetal force. You can go like that. Hold, it goes weak, and go like that. Strong, so you can correct it by moving like that with the hand. There's also a transverse force that runs across the body. You can test it like that, hold, and then we want to bring it in this direction. So you can use muscle testing to speed up your polarity treatments as well as to locate specific problems. Thank you.